We're down to the last. Good evening, everyone. I'm AnnMarie Cronin, and I'll be hosting a special live broadcast tonight on 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is with us again tonight to talk about how to avoid heart attack and stroke altogether and what you need to do to prevent Alzheimer's and many of the other chronic diseases. If you have a question and you want to talk to the doctor directly, make a note of this number. It's 800-859-0957. We'll repeat it throughout the show, but this is your chance to talk directly to the doctor. Stay tuned and we'll be right back. You're listening to 760 WJR. All right, so we're on Facebook now.
Yeah, welcome.
Welcome to
watchers,
Facebook,
viewers, Facebook viewers.
the followers on Facebook.
Yeah.
And we have
I don't
Siobhan
have the
joining
radio.
us.
Yeah.
We have
Yeah, I'm
Siobhan
glad to be
joining
back.
us from Munich, right?
Yep, I'm tuning in from Munich where it's midnight right now, and I think a little warmer than there, but
Well, it's raining here and miserable
Yeah.
outside, that's for sure.
It was nice
Yeah.
yesterday.
Was one
Warm
day out
and
of the year.
sunny.
That's
Well, we'll take the one day.
great expectations,
Yeah.
right? Exactly.
It's not freezing. It's not icy.
Mm-hmm.
It's not snowing.
You can drive around in
Can
it.
drive. Yeah, it's fine.
So what's the topic for today, or shouldn't we announce it until we start the live show?
Let's wait for the live show because then we start talking about it. We use all our best material on Facebook. Not
Right.
that you Facebook listeners don't deserve the best, but it is a radio show, so we should hold off a little bit.
Right.
well, we want the people calling in to know what we're talking
Yeah.
about at least. So
So, yeah, we're talking about failures of the standard of care. Couple real life examples of standard of care, or you could call it the substandard of care failure.
Mm-hmm.
So, yeah, it's pretty sad. And I mean, people, we're talking about people haven't died, but it's could have died.
Yeah, but the numbers aren't improving.
Yeah.
They're not going down. The number of deaths is not going down. I mean, after all the diagnostic tests that are out there, it's still an unknown, you know?
Right. So we'll get into that in detail. And if you have questions about your particular care and where you are in that process, give us a call.
Or just how to get the testing that they need. That's the main important thing. We're still talking about the CIMT all this time later. I mean, again, I'd like to welcome all of you to a special medical show here on 760 WJR. I'm AnnMarie Cronin, and we are here tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us again from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call if you have a question at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, always a thrill to have you on the show, giving us all kinds of information. And my co-host, Siobhan, out there in Munich, joining us where it's midnight and the weather's probably better. So let's start with the show. Dr. Kolender, what are you going to tell us tonight?
Well, thanks, AnnMarie. Today, we're going to talk about the mistakes that happen out there. And they're not really mistakes, but just why the system is broken. And we alluded to many times that we all know somebody who's had a heart attack, or after having a full normal workup, they were told they're okay. So someone who's a regular listener to the show joined the practice, and I had a chance to meet him. And this is someone who is a victim of the system.
can you define what a normal workup is? Not to interrupt you, but what sorts of tests would be considered as a normal workup?
No, that's a great question. So the normal workup is a standard lipid panel, which is just your basic cholesterol, triglycerides, HDL, which is your good cholesterol, LDL, the bad cholesterol, and then a couple ratios. And then, so for whatever reason, this patient's former PCP, referred him to a cardiologist. Again, no particular reason, or maybe he had a cardiologist. So I have to caveat as I just met him and I was reviewing his case. So I'm still learning everything I need to learn about him, but this story is haunting to me. So the cardiologist does what he does, which is get an EKG. He had him do an echocardiogram and a stress test. So he did all those tests, which are great. And of course, if you pass a stress test, the take-home message is that you're okay. And if the doctors, and he had 2 doctors overlooking his cholesterol management, and if they're doing what they think they need to do, then you're okay. So a couple weeks after his normal cardiac workup, and I'd say this is a pretty standard cardiac workup. Stress test, lipids, echocardiogram. A couple weeks later, the guy wakes up and he's in the cardiac intensive care unit having had a heart attack. And apparently
It's lucky he woke up.
Yeah. Oh, he was out for a couple days.
That's amazing. I mean, imagine the fright. I mean, I can't even imagine it. I mean, you see your doctor, you get a clearance, you think you're doing okay, and then you wake up in the hospital days later.
And what he said, I'm not using the exact words he said, but like, what the heck, when he saw his doctor, I just had all these tests. Why am I laying here? Why did this happen when I was cleared? And of course, there's no answer because there's no recognition that people that have a heart attack can have a normal stress test. The stress test is just screening for people that need a surgery at that moment. And it's not that that person developed a blockage, from plaque in the 2 weeks after his workup. He ruptured a plaque. And the most common person to rupture a plaque has less than a 50% plaque buildup. And that is not an amount of plaque buildup that causes any symptoms or triggers an abnormal stress test.
You would imagine a cardiologist should be the number one person to know that, though. That's what's most shocking to me, is that's supposed to be the specialist of all of this.
Well, we've been talking about how all of the doctors who are practicing population medicine are failing their patients because the fact that the system doesn't allot for prevention doesn't mean that they shouldn't, as doctors, be finding the way to best take care of their patients, but they're not. So we're going to talk about this in much more detail as we go through the show, but for the average listener, if you're not having a doctor who can take the time to really investigate preventive tools, you've got to leave. And that means leaving anybody who primarily takes insurance, because insurance doesn't cover prevention and never has and probably never will. In fact, I just got detailed, from a drug rep on a medicine that was newly indicated for heart failure. The problem is, in order for this drug to be covered, you have to have heart failure. There's no room for recognizing that you will or won't have heart failure before you actually have it. And that's how our system is. You can't have a drug for a problem or even recognize that you have a problem until it's happened. And that's not prevention, that's reaction. So, we'll go into more detail about why a stress test doesn't work, why it's a waste of time to get one altogether, why would even someone get an echocardiogram, and then why are we being told that's okay, and all of the other things that this person had that were missed. He has many root causes. They were all missed.
He's lucky he survived.
Yeah.
I mean, obviously we're out of time. We'll come back and talk about it on the other side of the break. Again, you're listening to our weekly live medical radio show where we keep you up to date on all medical solutions From dealing with COVID to avoiding catastrophic disease. We're here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you'd like to talk to the doctor directly about what you ought to do to prevent or reverse disease, don't hesitate to call 800-859-0957. Again, it's 800-859-0957. You're listening to 760 WJR. And we are back again on Facebook. And what I didn't get a chance to say but may come back and say when we come back is, I think there's this God complex with specialists, even the word specialist. You know, it's the idea of you're getting referred to a specialist and the cardiologist is a specialist. And therefore, if I'm already being bumped up the flagpole to see a specialist, then I can just rest easy thinking that he's going to give me all the tests that I need to know about. I just don't understand why it is as to fall in the population whose blood is getting sucked dry by insurance to not even know what's out there. Patients are still consumers. They deserve to know.
Well, we're here to tell them and educate people about why your cardiac workup was a total waste of time. So imagine your deductible's not paid. You know, when you go to the cardiologist and you got $1,000, $3,000, $6,000 deductible, and you just got a bill for $3,500 plus a $400 office visit.
Right.
And it was utterly worthless.
Total waste of time.
And that's, I mean, that goes to, we should talk about this is good enough for the air, but that's for everybody.
Right.
There's no such thing as a asymptomatic stress test. And I had a patient, you know, I had another person today I saw who, you know, he's doing great. He's diabetic. He has an abnormal EKG. So there's plenty of reasons for the cardiologist to think, oh, I've got to get a stress test because it fits some criteria that allows insurance to cover it. Doesn't mean it's it has any value. And I had to tell him, look, that just, you don't need any stress tests anymore because God forbid it's abnormal. It's a false positive. Then he's got to go and do additional testing that's invasive to prove what we already know, which is he doesn't need that test. He doesn't have a problem. Now, this other guy, he was a mess. So let's talk about, you know, a little more. We've done this before. It's been a long time since we talked about why stress tests are a waste of time.
Yeah, I mean, it's just unfortunate that people are being misled into thinking that they're home free if they get the test. I mean, I don't know why they're not all involved in, you know, pushing the CIMT, because then you get into the really invasive tests of the next jump. But I think you have to be pretty much in the hospital by that time. Anyway. We are almost going back. Welcome back to our special live weekly medical show on 760 WJR. We're back again with Dr. Brian Kolender, MD, internal medicine physician in Birmingham, Michigan, and specialist in prevention. As a recognized leader in the field of catastrophic disease prevention, including heart attack, stroke, diabetes, and many chronic conditions, he's here with us tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. Through advanced and more sophisticated diagnostic technology, we're now able to arrest and reverse the progress of these silent killers. We're inviting you to call in if you have a question at 800-859-0957. Again, that's 800-859-0957. And I just want to say a word to our listeners. If you have the ability to get on Facebook, we always discuss during the break some stuff that we have to come back and repeat again, but there's always a lively exchange of information going on in between the break. If you have access to watching the show on Facebook, don't hesitate to do it. Well, Dr. Kolender, you're telling us about this catastrophic situation. You have a patient who was given all the normal tests. The sad thing that I said on the break, which I'm saying again, is that I think the population, they have this God complex about if I'm being sent to a specialist, quote unquote, a cardiologist, there's no way. I'm in the right hands. Nothing can happen to me. I'm getting the tests. And my question to you is, why are the cardiologists not doing the necessary tests? Why are they still doing Mickey Mouse tests?
Well, why just include cardiologists? Why not add in all the primary care doctors, endocrinologists, anyone who has an opportunity to recognize a condition that they treat before the condition starts are all complicit in missing opportunities for their patients. And everyone is, really obliged to follow the FDA, which requires diagnoses to be made in order to get treatments that are approved by the FDA and covered by insurance. It's really the whole thing is that if it's not covered by insurance, it's not okay. And that's been a brainwashing. Other things in our lives for which we have insurance, we know that we have to pay out of pocket for maintenance, except health. We assume that there's no maintenance on our health unless it's covered by insurance. And that's the problem, is that because preventative opportunities are not recognized by the system as established by the FDA and the insurance companies, we don't have these chances. So we're all ingrained in that if it's not FDA approved, then it's not covered by insurance, it's not good. And that's our problem. So there's no way to identify plaque in an insurance process. There's no way to identify that you're at risk to become diabetic until you are, if you're based on insurance.
Okay, well, Siobhan, you've got a caller. Let's take the call.
We have David from Windsor on the line. David, what's your question?
Yes, my question for Dr. Kolender is this. We often hear many cases of doctors having malpractice suits against them. Wouldn't that be possibly due, on the one hand, of misdiagnosed conditions on people, and undiagnosed heart conditions? And I've asked the question before, but I'll ask it again. When you walk out of a doctor's office, they give you a clean bill of health. The next thing you know, you drop dead of a heart attack. What can you suggest about many doctors being called out for malpractice suits? What can you suggest about that for those that are not properly diagnosing the person's health condition?
Well, thanks, David. You're really setting me up to
It's a loaded
have
question.
all my colleagues really hate me. So more than they might already. So the unfortunate reality is that this patient had everything done properly by the level of care that we have in this country.
But the level of care is not coming up to the proper standard of care.
I'm not disagreeing with you, but if this, again, I'm not a lawyer, but if this went to court, it would fall into the category of things happen that were out of control.
Right.
Now, if the standard of care were greater, then okay, missed opportunities were had. So let's talk about this guy's missed opportunities. And then next segment, hopefully we'll get into why is a stress test a total waste of time? So this guy, of course, had insulin resistance. And if you're a regular listener, you know that the insulin resistance is the process of becoming diabetic. And you do not need to be diabetic for that process to impact your health. So this guy is not diabetic. His hemoglobin A1C, which is a blood test used to manage diabetes, is rock solid normal. But it's obvious to me by the patterns in his lipids that we did that he has severe insulin resistance that was ignored. So of course now he's
okay. Wait a minute. I'm going to jump in. Why was it ignored?
Because it doesn't have a diagnosis. There isn't there isn't a diagnosis for insulin resistance. There's no drugs indicated by your insurance company to treat insulin resistance.
But it is a warning sign that something's wrong, that you need to dig deeper, because that's what you're doing.
I know, but we're in a circular conversation. It's, of course, no one's doing it. So you're asking we're saying what was missed by this guy. So they didn't recognize he had insulin resistance. The second thing is he probably has sleep apnea, and we're tested him, we're waiting for the results. Not identified. I'm going to say the odds are 99.9% that he has sleep apnea, not identified. The other thing he has is he has elevated uric acid. And as we've talked before, anything that generates inflammation in your body, like psoriatic arthritis, lupus, rheumatoid arthritis, all those things can cause heart disease. So gout, which is very common, can cause heart disease. It's an independent contributor, independent of your lipid measurements and treatments. That and so his PCP somewhere down the road in the past, because he hadn't had a gout attack in 10 years or whatever it is, stopped his gout medicine, and his uric acid goes up. And even if you don't have gout and you have a high uric acid, that's an independent risk for disease. And any and all of these things could have tripped this guy up. And when I'm talking to him, he's like, no one's ever told me any of these things. I was told I was okay. And none of these things were mentioned. I mean, so to David's question, is stopping gout medicine in someone who's had gout malpractice? In my opinion, yes. You know, you do not stop gout medicine in somebody, even if they've not had an attack in years, because we know now that gout is a chronic disease. Even if you don't have symptoms, the elevated uric acid, even if it's mildly elevated, generates an inflammation that contributes to other chronic diseases, specifically heart disease. And there's a lot of research that shows if we treat the gout, you lower your risk of having a heart attack. And maybe that is the one thing that tripped that guy up. Maybe it wasn't the sleep apnea. Maybe it wasn't his insulin resistance. Maybe it was just the gout. That the doctor stopped his gout medicine, and that was it.
I know, but I'm not quite understanding why this panoramic, sample of symptoms that a patient has.
Why
Why
no
is
symptoms?
well?
That's the thing is you don't
he had insulin resistance,
but there's no symptom there. It's a
but he
way
had a
of
diagnosable malfunction.
it's not diagnosable because there is no diagnosis code for insulin
well, how
resistance.
do you find out your patients have insulin
Well,
resistance?
because I know that insulin resistance. I look at the labs. There isn't a specific blood test for it, but I elicit patterns from what's there, and we can talk about that next segment of what is it. What are the patterns we've looked for, and we've talked about that a lot. But it's because there isn't a drug for it, doctors don't recognize it because all they have time to say is, hello, here's a script, goodbye.
Mhm.
And if they don't have a script for that problem, there's no treatment or recognition of it.
Well, that's not that's not encouraging for the people that may be candidates for the next heart attack. But right now, we've got to take a quick break. Again, you're listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you would like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or you have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, 800-859-0957. You're listening to 760 WJR. And we are back again on Facebook. But wait a minute. So just so that I can clarify this in my own mind, you discover patients have insulin resistance.
Because I
Therefore,
don't
it's
take
diagnosable.
insurance.
I know, but
Well,
it's
no, not
diagnosable.
diagnosable in the
It's
sense of insurance code.
it's recognizable.
Okay.
It's recognizable. It's a process. It's not a diagnosis based on the FDA. To me, it's a diagnosis, but I don't bill insurance. So it's recognizable, not diagnosable.
So
But you also, you mentioned
go
in the
ahead,
first
Siobhan.
segment, I think the paradox of pharmaceuticals too is that you have a drug that can sort of treat something, but you have to already have the disease, so it's already kind of too late. And so it's like sort of this circular thing that it's not actually helping.
That's why our system is reactive. You don't get a treatment until you already have a chronic disease. And that's the whole irony of what's the predisposed illness about the insurance? I forgot the term, that they don't cover a pre-existing condition.
Mm-hmm.
You have to have the pre-existing condition in order for insurance to cover it, but then they won't cover a pre-existing condition. It's a joke. The whole thing's a joke.
It's really pathetic, though, to think about the fact that you figured out a way to find this information about your patients, and you talk about insulin resistance on almost every show.
Well, it's
Well, it
so
takes time
common.
for investigation. But
Okay,
Yeah.
but
go
that's
ahead.
the doctor's job. I don't care if it's the PCP or the cardiologist. I mean, patients are
Yeah, but
out
it
there.
requires the structure. The doctor has to adopt that structure of having the time and the ability to look at the necessary tests.
You can't identify this stuff, AnnMarie, until you've left the system. I didn't start seeing this stuff until I stopped being taking insurance. Then you realize, oh, there's things in this world I can do. But until that happens, you're too busy billing insurance for your living.
So the big bad wolf in the room is insurance, and people
It's the
need to.
FDA.
Well, okay, we can't do anything about the FDA, but we certainly can do something about the insurance companies.
Really, what? They're
Join
bigger.
a concierge practice
Well, they're
and say
bigger than the
we're.
FDA.
Well, yeah, right,
Yeah.
exactly. But I think that there's a thought process I see in this country a lot that people tend to think I'm getting a job that gives me
Look what I have
insurance.
to do on my own, Siobhan. I don't
Right.
have. I don't,
Oh my
this
gosh,
is so pathetic. I have to pour my own darn.
What a
wine.
shame.
what a shame. No servants here tonight.
Right.
But yeah, I mean it's just
This
ridiculous.
place is terrible.
Well, it's been good so far. So, but really, I mean, when you really stop and think about it, I think that so many people are enamored by the fact that they have a job in a company.
Well, they
That
think, oh, I
gives
got
them
great
insurance.
insurance.
Great
I
insurance.
got great insurance.
No, you don't. You don't have
Great.
any insurance.
Right. You
have
don't.
useless insurance. Because basically, you have to be your own advocate and find out what's out there and find out how you can get to the root causes, and that you can get the diagnostic tests that have been out there forever. I mean, it's just really pathetic. I don't know what the answer is, but I mean, unfortunately, people need to find. I mean, they have to go on their own discovery process. Anyway, just not sure how you get that. Go
So
ahead.
let's talk about why stress tests are terrible and a waste of time this segment.
Mm-hmm. Not just stress tests, everything. It's stress tests.
Well, let's focus on that one because this guy had the almighty stress test, and that's what earns the pat on the back from the cardiologist.
Mm-hmm.
We may have a call coming in. He's typing.
What, Siobhan?
We may.
Do that first.
No, I don't know yet.
Welcome back to our special live medical broadcast on 760 WJR. We are fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, here tonight to give us some straight talk about two important topics: prevention and being proactive. Please tune into our weekly shows Sunday afternoon at 3 and live Thursday at 7. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. Again, that's 800-859-0957. So, Dr. Kolender, over the break, while we're on Facebook, and I'm encouraging everybody who has access to Facebook to watch us on Facebook because we talk about a lot of stuff on the break. But, I mean, we're talking about a specific patient who had a horrifying example, and his example was that he, had a heart attack.
Well, we'll talk. What I really want to talk about is why did this guy go through a cardiac workup? He had an echocardiogram, a review of his labs and treatment by a cardiologist, and a stress test, which he passed fully. And then he was told that he's okay. And then 2 weeks later, he wakes up in the cardiac intensive care unit wondering, how the hell did I get here? So let's take a call, then we'll
Okay, go ahead. We have a
talk
caller,
about that.
Katharina.
Yeah.
Or Siobhan, go ahead.
Yeah. We have Jeanette from Grass Lake on the line. Jeanette, what's your question?
Yes, I'd like the doctors to address the importance of dental care, especially for seniors. And what's difficult is a lot of times dental care is not covered by insurance. I'll hang up and take that as the doctors could address that as a preventative for full health as well as heart.
Well, thanks for calling. And, so dental care does contribute to heart attack and stroke.
And may I say before you continue that it's pathetic that it's not covered, and even more pathetic that those people who do have insurance are getting like $1,000 or $2,000 a year, which is nothing. So they're spending that on their, hygienist and whatever filling they need, and they're certainly not getting the preventative tests that they need to get from their dentist. But let's move on ahead. That's another failure of the insurance company.
And to that end, I would say dental care should be medical care because now we know that there's dozens of diseases attached to bacteria in our mouths that cause these diseases. So one of the things I do in my office is a test that recognizes the burden of these various bacteria, specifically the ones that are related to chronic illness. And just like we said, sometimes there's only one trigger, one thing that puts somebody over the edge. Sometimes it's oral health. Everything else, we're doing the best we can. The person still has plaque. They're still actively making plaque. We go treat their oral health with an expert, and it gets better and their arteries heal. So it's very important at any age to maintain good oral health, use a water pick, see your dentist, make sure your gums are healthy, and of course, ask your dentist to identify the diseases in your mouth that specifically contribute to chronic illness, because that's a data point you can follow. These are all things that you can measure over time. Am I lowering the burden of this bacteria in my mouth? And they're all important.
The problem is you've got, maybe 3 or 4 or 5 dentists in the entire listening area that are doing what you're saying they should do, which is being medical dentists and doing this pre-diagnostic work and diagnosing the bacteria in your mouth that leads to these serious
Right.
diseases.
Unfortunately, cosmetic dentistry has become very popular.
Right.
And the time in that chair is costly to the dentist if they're not putting in implants. So you got to pay for an implant to get your teeth taken care of.
Yeah,
Anyway,
I mean, again, it's the love affair that Americans have with their insurance companies. What can I say? I don't know how you challenge that, except to tell people and the listeners that, it's incumbent upon each listener to know that they've got to push the envelope and they've got to not be in love with their insurance company anymore.
well, insurance is really for catastrophic injury, and we're
Right.
letting people know that prevention is not covered. And so even though you think your insurance company is the end all be all for healthcare, it does not cover prevention. You've got to go outside of that to get those services. And that means you got to find them on your own, because your doctor doesn't know how to do anything except what's covered. So what is covered is a stress test. So here, go back to our patient who passes his stress test and then has a massive heart attack 2 weeks later. And, so why does this happen? So the reason stress tests failed this person is because a stress test is not recognizing plaque at risk for rupture, which is what caused this man's heart attack. Stress tests recognize only plaque that is currently blocking blood flow. And those people who have stable plaque, and when I say stable, there are people who make stable plaque that doesn't really rupture, that doesn't put them at risk for an unexpected event, and they progress to a blockage that causes symptoms, and that person would fail a stress test. The rest of us that don't have symptoms do not have a blockage that's more than enough to cause poor blood flow during exertion.
Yeah, I think there's a massive misunderstanding even amongst people that I talk to in, their 30s, 40s of what really causes a heart attack. The thinking that it's really based on blockage rather than plaque rupture, which is just a huge misinformation gap in what people are being told about where heart attacks are coming from.
And Siobhan, you'd be surprised to recognize that doctors may not know. And even if they know, the practical answer is they don't have a way to find it. So they still think about stress tests as a way to find a blockage. So this is just not news that's out there because it's not actionable to your doctor who takes insurance. So they see an abnormal EKG or the person has some symptoms. I mean, a stress test can be the right move if you're having angina, meaning you have typical heart symptoms, crushing pain, tightness, shortness of breath, irregular heartbeats, nausea, sweating, usually with exertion, meaning with stress. So if you're putting your body through a stress test and with extra exertion, the blockage that you have now isn't enough to get blood flow to your heart because it needs more, but that blockage stops you from getting more, then you have angina. But our patient had a subclinical plaque that was very angry. Subclinical meaning he had no symptoms. It wasn't blocking flow. He didn't pass his stress test because he doesn't have a flow problem. He has an inflammation problem. And a couple weeks later, the inflammatory plaque ruptured. A clot formed where that plaque was to heal it, just like clots do. And the clot blocks the artery, and that happens in 10 minutes. So he had no symptoms of the rupture. The clot blocks him, his heart stops, and he's gone. And then he's just lucky he got found and resuscitated and wakes up in the hospital. And this is why people drop dead. And a stress test is not going to find that for you. Getting a stress test on an asymptomatic person is like playing pin the tail on a donkey. You know, you're blindfolded and you're just hoping you hit someone who's got a plaque that needs surgery. And even if you find a plaque, all the cardiologist is going to do, or your PCP, is put you on a statin, you know, which is not wrong, but they're not looking for all the other things that cause inflammation and contribute to disease. They think they're done with that one move.
So in
And
other
then-
words, it's
Go ahead,
primarily
Sean.
used as a tool to screen for whether you might need surgery.
That's it.
Right, exactly.
That's
my
all
point.
any
Exactly.
blood flow test does, is screening for surgery. So a CT arteriogram, a stress test, an ultrasound. So even though we use ultrasounds, they're looking at inflammatory lesions, not blood flow. Anytime you walk away from a test that says, well, my flow, my blockage, you just wasted your time and your money
Mhm.
and your hope.
Yeah, that's really pathetic. I don't know. I mean, people just need to wake up and be their own advocate because the numbers aren't going down of heart attacks. Anyway, we need to take a quick break. You are listening to a special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subject we're discussing and you'd like to talk to the doctor directly, don't hesitate to call 800-859-0957. Again, that number is 800-859-0957. You're listening to 760 WJR. I was about to get on to back on Facebook again. I was about to get on to the subject of, why are cardiologists, they're still not pushing the CT cardiac calcium scoring test. They're certainly not pushing the CIMT.
Well,
I mean,
because
You have
They're
to
not
see.
being
You have to
pa-
see
I-
the plan. I understand. This is all leading to a stent. Let's.
yeah, they're not
let's
getting
call
paid
a
to
spade a
prevent.
spade.
And there's a lot of disease out there, a lot of disease.
No
So
doubt.
they got plenty of time. They're busy stenting left and right. They've got all the work they can do. So, and I assure you, if we stopping heart attacks, they are still busy for 5 years.
Right.
There's still a lot of disease out there.
Yeah, and it's really pathetic to think. I mean, I went to interview a cardiologist, about maybe 4 or 5 months ago for an article I was doing, and I was shocked to go into his waiting room and see 50 people there. And I thought, I was imagining that the cardiologist would be a specialist having 3 or 4 people in the waiting room. And it was just like in, out, in, out, in, out. So it's exactly the same as what you're talking about, the PCPs. You're getting 5 minutes.
Because the PCP only has time to refer you. So that same patient's going to probably 4 other specialists. They're probably seeing their endocrinologist to manage their diabetes, which the PCP should be doing. They should be going to the, this is all primary care. This prevention is medical management. There's no reason to see specialists for basic diabetes, basic cardiac prevention, blood pressure. I mean, this is all within the realm of your PCP. And the fact that you got to spend more time in a waiting room, more money to get an opinion that you didn't need to get is sad. I mean, really, the system has made internal medicine utterly useless. Primary care is turned into a total waste of time. And this is why everyone's goes urgent cares, and these urgent cares are everywhere.
That's worse. What are you talking about? They don't have any doctors there.
You can't get in your PCP for just a cold or back pain, and The PCP isn't providing any service anyway other than referring you to specialists. So why go? I mean, it's a huge business, this urgent care thing. I think it's horrible for healthcare. Horrible.
I mean, I think it's a terrible risk. I mean, I remember, Siobhan, you remember you went to an urgent care once and were totally misdiagnosed and wound up having to go to another one where there was a real doctor.
Well,
I don't
Oh
know if you
yeah, I
recall
mean,
that.
people
you know, I
wanna
do. Horrible.
Yeah.
people want to see some, whatever you want to call it, a medical person. And even if they're going there because they have a nail, their nail's out of shape on their pinky, having a medical person review you and say you're okay goes a long way, and the person wants to hear what they want to hear, which means, well, I just saw a doctor and I'm okay.
Yeah, a lot of people
Never
think
mind that they went to for a sore throat and that's all that got evaluated. They still saw a doctor type person and they were told they're okay. And that is pathetic.
It's very pathetic.
Well,
people
don't know. They do not know what they don't know. And it doesn't matter what your education status is. You believe what you want to believe.
And the white coat carries a lot of weight. It's unfortunate. Welcome back to the final segment of our special weekly live broadcast here on 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitating disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician, and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that's 800-859-0957. Okay, Dr. Kolender, the final segment. Before we get into the final segment, I just want to let listeners know if they are looking to find out about these tests, where to get them, what tests they need to have. They're welcome to call you at 866-Kolender, 866-KOLENDER. I'm sure your office will be happy to guide people in the right direction. So let's finish off this discussion about this very lucky but unfortunate patient who went through the system and still had a heart attack.
Well, it's hard to keep going on this conversation, to be honest, because, if you were listening on Facebook, this thing devolved into it's a total waste of time to see a doctor in the United States, period.
That's
really our
not
conclusion.
helpful.
That's not.
That's our conclusion. It's a total waste of time.
We don't have
if
any
this
choice.
guy can go to his PCP, have his gout medicine taken away, which probably triggered his heart attack, goes to see a cardiologist, does all the right things, and he has a heart attack, what's the use? Now, AnnMarie will say, all right, this would never have happened in my office. Never, ever, ever. We do the right things, which we're not going to go into detail.
But
and
you're
we got
a
a caller.
population of one, and we've got a caller. Let's take the
this
caller.
place is a joke.
Okay.
Go ahead.
All right, go ahead,
so
Siobhan.
we have Mary Ann from Clarkston on the line. Mary Ann, what's your question?
My husband has had a tightness in his chest, and it causes nausea, and he gets very lightheaded. We've gone through all kinds of testing, and they can't find anything wrong with him. His family has a history of AFib, and I'm just wondering, I'm listening to what you guys have been saying, and what type of test should he be undergoing to see if he does have a heart condition that's going undiagnosed?
Great question. Perfect timing.
We're glad
Bravo.
you called.
Yes, got me off my negative
Soapbox.
soapbox. So the things that we do in our office that are not done in 99.9% of other doctors are, we do an ultrasound of the arteries of your carotid, where we can see the lining of your artery, not what's between the walls, but we look at the walls that measure risk. And those, if we see your plaque there, we take measurements that correlate to risk. We do blood work that measures plaque activity. And if those are all good, you need a CT calcium score to identify the presence of plaque based on calcium deposits that are left by healed plaque. So you need to identify whether or not you have plaque, number one. Once you've done it, then you want to find all of the conditions that can contribute to heart disease, such as sleep apnea, insulin resistance, gout, bad lipids, genetic issues, which are manageable. Just because it's genetic doesn't mean you can't do anything about it. And there's others that we do that look at that we got to go through all of them and address them in the right person. So that's what your husband needs to be sure that it's, is it vascular or not? And if you go through that process, you can say pretty confidently that it is or isn't. For instance, I had a patient call me on Monday that she had chest pain, that she's describing angina on the phone. And I looked at her chart. She has a normal CIMT. She has a normal calcium score. Her inflammation markers are okay. I told her it's not your heart. Take some antacid pills and see me. And then she couldn't see me for days based on her schedule. And I had felt no worry at all that I was missing her chest pain. 100%, it was not her heart because of the tests that we did. And we saved her an ER visit and we worked her up in the office for non-cardiac chest pain. So you can really rely on the process. And so that's what your husband needs to do. And that's what everyone needs to do. You need to identify the disease, which is plaque, and then systematically go through all the things that cause plaque and address them aggressively. And that's how, it's not that hard. I hate to say it. My job's easy. You've just got to do all those things, and no one in the practice, no one will have a heart attack. It's
I
not
can
hard
attest
at
to
all.
this because your story reminds me of my husband, who is also a patient of yours. And, every once in a while he'll say, oh, my chest is hurting or something. I'm like, well, we know for sure it's not a heart attack and there's nothing wrong because he's had the CIMT and he's had the CT calcium score test, and he's gone through the whole panel of testing. So it's an amazing relief to know that if that's someone you love says that, you can say with confidence, like, all right, we know at least you're not having a heart attack.
And he's also had the oral test for the oral bacteria to identify what kind of pathogens are in his mouth.
Yeah,
So
well,
he's
that
clean.
of course, but I'm
And-
saying ruling out at least the cardiac-based, risk level is a huge relief.
And again, to the caller, I don't know what tests they've done, but let's just assume they did a stress test and they did some type of arteriogram, whether it's a CAT scan. None of that tells you, because there could also be microscopic artery issues, which are also identifiable and measurable through different blood tests that, again, no one does in the standard system because you don't have time, and it's, getting insurance to cover those tests, forget it. But it's important to know if you're having heart symptoms and you don't have an answer. So you've just got to go and get those things done and sort through it. And it's not that hard. It's just no one does it.
So just to summarize this before we close down, your husband needs to get the CT calcium scoring test and the CIMT. If he hasn't had these tests, then right off the bat, he's been shortchanged. And whether his doctor does it or doesn't do it, then find a doctor that does it. Because as Dr. Kolender has said, and as Siobhan has attested to, those are the tests that are going to identify plaque, not the stress test and not the cardiogram and all of the other Mickey Mouse tests that are covered by our insurance, which is Mickey Mouse insurance. Unfortunately, those tests are not covered by insurance, but they are very inexpensive. We're talking about like $100, $200. They're really not expensive at all. They're not covered by insurance.
We're not quoting prices on the air.
We're not quoting prices, but people sometimes when they hear it's going to cost money, they're all frightened and thinking, oh,
well,
wow.
I mean, what's your life worth?
No, exactly.
What's your life worth? What's it worth to have heart failure and have to be pushed around in a wheelchair the rest of your life? Or, you can't breathe. You can't go to your parties. You can't go to your kid's graduation or wedding because you can't walk down the aisle because you can't breathe. I mean, it's really not, it's just something you got to do. So, and the same goes for cancer. I mean, now we can identify stage 1, stage 2 cancer with
the blood
simple blood tests. Now, you got to pay for them, but it's, $1,000 and you know that you don't have any of those cancers, or we got to go on a witch hunt looking for it. Better than getting a diagnosis that you're going to die in 3 months.
Yep.
It's all there, and it's out of the general system, for which is useless.
So, I mean, the tests are out there, everyone who's listening. And if you can't remember what they are, feel free to dial 866-Kolender. 866-KOLENDER. Dr. Kolender will tell you again what tests you need and how to get them. So, Dr. Kolender, final word?
Oh, well, it's do not rely on the current system or doctors working within the system to assure you that you're okay, because there's nothing about what they're doing can tell you that you are or not. You got to assume that you're in bad shape, and you need to fully identify your
Don't rely
processes.
on your insurance company either. Well, unfortunately, we're out of time. So I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Thanks again to my co-host, piping in from Munich, Siobhan Cronin. Thank you, Siobhan, for being with us. Please continue to tune into our shows Sunday afternoon at 3, Thursday evening at 7 for the latest medical updates. And thanks for listening to 760 WJR. Good night and be well. Good job, Siobhan.
Good job. Great show.
Yep.
Was
Thanks.